adolescents and young mothers are experiencing significant barriers, including stigma and discrimination, to accessing voluntary family planning and reproductive health services in Kanara landing site in Ntoroko District. Though self-care interventions have been shown to reduce such social barriers to family planning and reproductive health care, little information is known about these interventions, particularly in these low-resource settings, with the district records showing teenage pregnancies standing at a staggering 25%. Adolescents and young mothers now think that if they're empowered to be in control of their own health, such cases of teenage and unwanted pregnancies can significantly reduce. Self-care is a significant initiative aimed at empowering individuals to be in control of their own health management, ultimately alleviating the burden on health care workers. Rehema Kabatoro, a resident of Kigunga village in Kanara sub-county who gave birth at 16 years, says many adolescents at Kanara landing site experience fear and shame when purchasing contraceptive products and subsequently avoid health facilities.
Ntoroko anyanja tutwarenda tuchali bana bato aba tukumanya engeri okozesa family planning aro muisiko ndi no musanga mwana muto tamanyire engeri okozesa family planning natina ona swara kuga airwaru kuga kufuna family planning so ito tuventu saba itwe kabaisiki bato ba Ntoroko Kanara tuventu saba at least abakuru bafune engeri yokutuegesa kutusomesa tumanye engeri yokozesa ki family planning so iwe nko mutu okoleki omanye engeri yokozesa family planning kwetatara kutwalenda tuchali bana bato abo kuba netwazamu kubi embera ambi nozara wena togondeze noba toka tegekera kwetegeka kuzara nozara ochali mwana kandi mumaiso nekoraki nekubonesa nkanyoanu nkazara nchali muto ine miaka 17 nchasoma sazinu nyino mwana ine miaka 7 sazinu ni nentwara mu nindora wena kumurolera gumira linyo abokuba nkazara tinkategekere kuzara so mbe ni saba bakuru baije batuegesa hano amwaro engeri yokukozesaki family planning omuntu weka omanye engeri yokukozesa family planning so kwetatare genda yokutwara togondize kandi ochali mwana muto.
Bob Kuguma, a youth in Kanara Town Council, says many young people are not equipped with skills and offered essential items they can use to manage their own lives. For example, he mentions that the condom box at the town council has not been refilled for the last 1 year.
Here at the showers, we have very many young girls and young boys who don't know actually how to use condoms, how to use those pills, they don't know how they can inject them. So they need to put away how to come and sensitize the people on family planning. We are bordering another country. Every time and every day we always receive very new people here in our village. So some are aware and some are not aware. They have taken some good time without coming to sensitize again. That's why now we are getting very young girls and young boys, young girls who are getting pregnant, who are pregnated at the early ages, because we are receiving very many people here. So we need more sensitization about family planning here.
Another youth, Sandra Sarah, who gave birth to twins at the age of 16 years old, was lowered in 2 sacks after being convinced by the boyfriend that she was in her safe days and wouldn't get pregnant. She now wants self-care awareness on family planning integrated in the routine health awareness campaigns.
Kwa majina naitika na jina Sara Sandra, natoka Kanara Town Council. Tuko pale kukampu nilibeba mimba na miko kukampu. Mpaliwa nilibeba mimba na miko mtoto. Nilibeba mimba tena mbio mbio, nilipata mwenye tafani atasaidia mie. Tena mimi naongeza mimi nabeba mimba mbio mbio nyuma mtoto mimi nazala. Lakini maisha nashindikana miko kukampu. Nipaliwa gizi ya kujichunga ya kuzala. Lakini sasa hivi nataka mnifundishe juu ya family planning. Kwa juu mpaliwa gizi ya kujichunga nyalotea mimi nazala mbio mbio.
Fred Chotumo, the chairperson for the youth for Canada Town Council, said that due to the huge challenges faced by families, notably for those that are staying in camps, many young girls are engaged in commercial sex without basic health information.
True, our girls have been suffering for several time because of getting the pregnant when they are still young. And on my side, the only thing that I can be able to speak or maybe to give you is to request the government, because this thing has been happening for several time, but the government is not coming and find out or maybe doing an investigation on it. So my suggestion is let the government also still come in and try to help, because we as a parents, we are suffering because of our children getting pregnant when they are still young. In most cases, there is some of the things that the government can also put there, such that they should avoid getting the pregnant. For instance, children using condom when they are in their whatever, doing like maybe having a cooperation of love between the girls and the boys. They may still be able to use condom such that they should avoid getting pregnant. There are another method of using like a pill plan or maybe family planning. Some of the ladies may also use the female condom. Sometimes I do hear from our aunties and some of our mothers are telling us that when you reach at the health center, you find when they are injecting them or giving them injections. At the same time, they have some of the plastic that they do put in their hands for protection of not getting pregnant. So I'm begging and I'm requesting from the government, let them provide some of the workshops sometime to teach our children to understand what they are supposed to do, because our children getting getting pregnant when they are still young, it has really given our children a challenge, and some of them have come out from school.
Jessica Bahat, a VHT at Stella Maris Health Center 3 and a health counselor at Ntoroko Hospital, agrees that if young people are educated about self-care, it can reduce the risk of costly non-communicable diseases.
Itwe nkaba VHT mu Canada Town Council ekintu cha family planning ntulenga okumobilizinga abaisiki abo kurorangu bayerinda orundi bagenda family planning. Chokorora tutunga family planning hairwaro lya government Ntoroko Health Center 3 tutunga MR stop erabamu ne mobilizinga abantu bagenda family planning bagende be to have abana abato kuba mixed na abantu bakuru bahura bayinensoni no sangango abantu bakuru nubo bagenda family planning be to abana tibakugenda family planning abo butini bwingi no sangango mwana na bayinensoni kuba mixed yamu na abantu bakuru ati nabweki cyo kubere kirungi abana abato nabo batunga program ya family planning orundi kuraba mu masomero orundi kuraba mu kuba mobilizinga kwija hamu ka meeting au ka group bali age range ya abana abato ekikiswa kuyamba Town Council.
Patrick Bierhanga, the Ntoroko District health educator, agrees that the lack of self-administered contraceptives among sexually active girls, especially those not captured by the national guidelines to access family planning, has negative effects on their lives and reduces their economic potentials.
So in Ntoroko we have an issue of early pregnancies, especially child pregnancies. If when someone 13, 14, 15, some of these young girls, they are pregnant, some of them have beared children. By the time a girl reaches 19, she's either having 3 or 2. And then the majority of them find find themselves dropping out of school because of pregnancy. And one of the reasons which could have led them to going into pregnancy, probably they are trying to explore. They are trying to explore. Others could be because of poverty. Poverty sets them. Some are in school, they drop out because they cannot be supported. Then they end up going out, and then in the end, they end up having early pregnancies. So, but what I know, some of them are aware of the services they offer in family planning. Some of them go in for injectables. Some of them go in for implanos, which is put in the arm to protect them from getting pregnant for 3 years. That's one of 3 years and 5 years. Some of them don't actually just go there. Some of them don't use. So that one has been evidenced by the fact that some of these girls are getting pregnant. Because if they were using family planning, some of them would not be getting pregnant. So at the end of it all, some of them, by the way, we have cases of gender-based violence. Some of them are being raped. They bring them, and then you find some of them, when they come at the facility, they already have acquired STIs. Some of them have HIV, and then others, you find someone is pregnant. So self-care is actually limited because it's actually limited, and we are expecting that our VHTs would be doing a lot of work. But of course, VHTs don't work on full basis. When it comes especially at the lake shore, where the only activity at the lake shore, majority of it is fishing. So you find some of the girls leave the villages and then go at the fishing village, either to see their relatives, or they specifically go in for the habit of commercial sex. And these are young girls and young boys who probably might not have an aware or information about these infections and the rest. Instead, they go in to look for what? As a way of survival. And then in the end, some of them end up getting pregnant, some of them end up getting sexually transmitted infections, and others end up getting HIV infections. This has been revealed by our database in HMIS 2 when we are reporting. So you find that young girls, we call them young mothers. So we have a number of them. The number is high. So I might not quote exactly what it is, but I know in Ntoroko it is high. It is high. Teenage pregnancy is high. So, but there are those who are using the family planning services. Apart from there are those family planning services that are supposed to be direct. For example, like the ones that insertion. Of course, they can't go in for them. They fear to go at the facility to be given insertion. Some of them cannot go in for these or the permanent because they are still young. But these issues of tablets, the tabs, and the implanos, and then the Sayana Press. Some of these services are being offered by VHTs at local levels. And when they come there, of course, they cannot deny them those services. They offer them those services. So our VHTs are playing a very big role in also sensitizing the communities, sensitizing the youth, the adolescents, and schoolgoers about family planning issues in addition to the elderly. And when they are doing this one, they don't segregate. They give information to both boys and girls. But majority of them whom we have found having some challenges are what? Are girls. Although some of the boys, few cases come with infections, and then they are treated. Of course, when someone comes with an infection, it's an evidence that someone is already going in for sex.
However, despite these gaps, Uganda has initiated efforts to raise awareness about self-care practices, to reduce hospital visits and allow health workers to focus on patients with serious health illnesses. Now, development partners like Center for Health, Human Rights and Development, CEHAD, have been recommending for regulatory frameworks that incorporate self-care concepts and raising awareness about its significance. Patia Kiange, the Executive Director at the Center for Health, Human Rights and Development, CEHAD, says there must be programming around giving sexual reproductive health information so that young people are able to make informed decisions.
Also, self-care embraces self-awareness, and self-awareness for me to be aware that when I do this, I will get an STI, a sexually transmitted illness. When I do this, I will get HIV/AIDS. I need to have the information. So one of the pillars for self-care is health literacy. Health literacy takes us back to health information. Do the young people at the shores of the Lake Albert have this information, sexual reproductive health information? They don't have. So you said, what can we do? Now that takes on family planning. Are they getting the information on family planning? Because you see, family planning is many things, you know, even having the use of condoms to have protection is family planning. But do the young people, do they know about it? So for me, one of the key interventions that have to happen is to ensure that there is programming around health information, giving sexual reproductive health information to the young people in those hard-to-reach areas.
Rosalind Achola, a technical specialist for sexual reproductive health and self-care at the Ministry of Health, mentioned that self-care empowers individuals to make informed decisions about their health management through the information provided by health workers. However, she urges that while self-care is connected to health system, it should not include self-medication.
So it's very important for the population of this country to understand and practice self-care. That means when you practice self-care, you will be okay. You will be fine. And there are 5 principles that we are talking about. That there must be that awareness that it has to know, and today we are here to create awareness. Then 2, there must be healthcare professionals to help give that information. Then 3, there must be a health system. You all know we have the health system in this country, and self-care is the health system. And then we have the medicines, the supplies. What are those things that people need to practice self-care? And then lastly, the technology. For example, those who are doing self-injection, we have the technology that people are using to inject themselves.
According to the World Health Organization, there is an expected shortage of approximately 10 million health workers by 2030. The World Health Organization advocates for self-care interventions as a vital component in achieving universal health coverage, promoting health, safeguarding the world, and serving vulnerable populations. Report compiled by Basaija Iddi, a journalist at Uganda Radio Network.